So, you've heard about the Radicals trial. You've had a chance, I hope, to read the information sheet. So now, would you like to ask any questions about the trial today?
Yes. Why, if I've had such a good operation, do I really need radiotherapy?
Okay, well that's a very good question. So yes, you have had a good operation, and we're not suggesting otherwise. However, some men who've had a good operation are at risk of the cancer coming back again. And now that you've had the operation, we're able to make a good estimate of how likely it is that your cancer is going to come back again in the future. So we know your PSA level before the operation, we know your Gleason score, what the pathologist tells us when he looks at your prostate under the microscope. We know whether or not the cancer extended up to the edge of the specimen at the time of surgery. And we also know whether or not the cancer extended outside the prostate. And with all that information, we can tell you the likelihood that the cancer is going to come back again. And if you hadn't got any risk factors for recurrence, then it's highly likely the operation would have cured you, and you wouldn't need to even think about any additional treatment. But when you have got one or more of those risk factors, then there's a significant chance that the cancer could come back in the years to come. Maybe a 30% or even a 40% chance of that happening. Now, we know that if the cancer does come back again, the best treatment is radiotherapy. We know that radiotherapy reduces your chances of dying from prostate cancer and improves your chances of long-term survival. But what we don't know is when it should be given and who should get it. And so the reason you might like to think about taking part in the trial is because there may be an advantage to you in having radiotherapy, and the trial will help us to find out who should get radiotherapy and when they should receive it.
What if I take part in this trial and at the end of it find that I have made the wrong choice?
So there are two schools of thought with regard to the timing of radiotherapy. One school of thought favours early radiotherapy for everybody who's at risk of cancer recurrence after the operation. And the other school of thought favours deferred radiotherapy if and when the cancer comes back after the surgery. And at the moment, no one knows which is the better approach. And so both approaches are in standard practice throughout the country and across the world. And some experts favour early radiotherapy, and some experts favour deferred radiotherapy. So if you don't take part in the trial, if you choose not to take part in the trial, then you will have to choose whether to have early or deferred radiotherapy. And your doctor can help you, but only on the basis of speculation or educated guesswork. Now, if you do take part in the trial, then you'll be allocated either to early or to deferred radiotherapy. You won't choose and your doctor won't choose. And when the results of the trial are in, probably in about 15 years' time, then we'll actually have some hard evidence to know which is the better approach. And you're quite right, it may turn out that you were allocated to the less effective approach. But that's really no different to if you were not taking part in the trial, because equally you might choose the inferior approach if you were not in the trial. So the important thing to remember is that the trial is comparing two standard approaches, two approaches that are already used widely in current practice.
I feel really well now, you know. There's a few problems with the waterworks and all after the surgery, but what I'm worried about that if I do go on to the radiotherapy program, if the side effects of that will affect me and set me back a bit.
Well, it's true that radiotherapy can have side effects, and in particular you need to be aware of the risks to your bladder, bowel and sexual function. And so after radiotherapy, about 1 in 100 men will have problems with urinary leakage. So there's a 1 in 100 risk of that happening. And when it comes to the bowels, about 1 in 20 men will be left with troublesome bowel symptoms, either increased bowel frequency or increased urgency or sometimes bleeding from the bowel. There's a 1 in 20 risk of that. And then when it comes to sexual function, about 1 in 3 men will have increased difficulty with erections after radiotherapy. And obviously it's important that you are aware of those risks. Having said that, supposing you decide not to take part in the trial, then you may well still need to have radiotherapy anyway. So the risks of radiotherapy are not unique to the trial. It's important to realise that the trial is comparing standard treatments that are already widely used in current clinical practice.